Welcome to the AFR Saints channel, where we provide you daily content on your favorite team, the New Orleans Saints. Do us a favor and hit that subscribe button. Be sure to leave your comments below and smash that like button. Who dat?
I think it still remains to be seen. You know what I mean? At the Combine a few weeks ago, I was feeling a lot better about it, and yet I don't know that I'm seeing as much progress as I was hoping to see, at this point. So I think that still kind of remains to be seen. But here's the cool thing. We got plenty of time.
That was Dennis Allen at the NFL meetings about Ryan Ramczyk. At the Combine, things seem much better, and now they've apparently taken a turn for the worse. Ramczyk's missed a bunch of games in 2021, 2023. I wanted to just get a little bit more insight into what's going on there from a big picture scenario. Dr. Stephen Etheredge over at BREC, awesome guy, been very generous with his time over the years. One of LSU's team docs and a good resource for us. Hey, Doc, thanks for the time, man. How are you?
I'm doing good today. How are y'all doing?
Doing really well. First of all, and I know, to the best of my knowledge, you haven't treated Ryan Ramczyk, so I don't know that you can speak specifically about him, so we'll have to speak in some generalities. But what Ramczyk told reporters back in December is the cartilage in his knee has deteriorated, and that could cost him the rest of his career. What does that mean to have the cartilage in your knee deteriorate?
Yeah, so this is something that unfortunately we see in a lot of our athletes. Normally it's not something you think about in a fairly young individual. When you talk about cartilage issues, a lot of times we're thinking about arthritis, normal wear and tear that we all expect to get, when we're a good bit older than somebody like Ryan Ramczyk is. But sometimes if you've had other injuries, if you've had a previous ACL injury, a previous meniscus injury, and then throw into that, you got a bigger frame, he's not a small guy. So we see this definitely more commonly in a lot of our bigger athletes, our linemen, positions like that. Just sometimes that cartilage kind of wears down through a combination of previous trauma, normal wear and tear that he puts on it being an NFL offensive lineman. And when you talk about the cartilage, there's really two types of cartilage that we kind of consider. You have the articular cartilage, which if you think about the ends of the bone, if you're thinking about like a chicken leg that you're eating, and if you look at the end of it, it's got that white kind of soft stuff on the end. That's the articular cartilage. And then you have the meniscus, which is a little pad of a cartilage-like material that sits between the two bones. So when you hear these cartilage injuries, you're talking about both of those, but usually when they say the word cartilage over meniscus, it's usually the articular variety, the bone, the cartilage wrapping the bone. But these are injuries that maybe came, through from trauma, but then it just gets worn down, it gets thinner, and they're really hard to deal with. Unfortunately, it's not an easy fix.
So how does it limit having deteriorating cartilage? How does that limit a player like Ryan Ramczyk?
So if you think about the cartilage is the shock absorber, and it kind of fills those spaces. And as it wears down, you get more friction, more rubbing. So every time you bend your knee, every time you twist, every time you turn, every time you land on it, it gets inflamed. It gets irritated. When that happens, it might swell up a good bit. A lot of times if you hear about the guys who periodically are getting their knees drained throughout the course of a year because they keep getting fluid on the knee, a lot of times those are these same athletes, the ones who've had these cartilage injuries. And, sometimes your body can heal to some extent, but, cartilage is something that's really hard to regenerate. It's something that just doesn't recover as well. And so the more he does on it, the more it wears down. Unfortunately, these are very commonly career-limiting injuries, at the very least. Sometimes they can be career-ending.
Is it merely a pain tolerance issue, or is it limiting him in ways where he just physically can't move the way that he once did?
So it's a little bit of both. Pain is a big part of it because these things do hurt. And if you're able to tolerate some pain, sometimes you can push through them. But, if you think about it, as you get less space in the knee, that's what kind of happens. And as you get rougher surfaces, those surfaces will start to catch on one another. It will start to chew up some of the other stuff that's left, like your meniscus. So as you have less cartilage, you're more prone to get these other, further meniscus injuries. So you can develop mechanical blocks. If your knee keeps swelling up, even if it doesn't hurt, that's going to affect your mobility. It's going to affect a lot of those things, making the knee stiffer. So it can be a little bit of both. It's definitely an injury that can limit you, and then, pain is definitely part of it as well, though.
What can the Saints training staff and or Ryan Ramczyk do to limit the effects of this deterioration?
So, obviously, like you said, we can't go into the details of him specifically, but when you have these injuries, I know they mentioned, in the article, I think I saw a few days ago, that he had one of these, what we refer to as a clean-out procedure. So he did have surgery, and what they do with these clean-outs, without knowing the specifics, is they go in, and if there's little pieces of cartilage that are hanging down, because sometimes, like I said, the cartilage will kind of tear and hang down a little bit, they shave those down. So that's part of it, and that's what they did. And while, you're not fixing the knee, sometimes you're getting rid of those things that are causing the irritation, and they do better. And obviously, he's already had that done. Sometimes you'll go back in, but usually if the first procedure wasn't successful, unless there was a new event, a new injury, you may not. Obviously, part of it comes down to maintenance with these individuals. It's not just what you do with treatment, but how much you're going to have him, practice. These are guys, especially a veteran like him, you'll hear about it a lot. They take a day off during the week, or maybe every Tuesday or every Thursday they have an off day, that's scheduled into part of their work. So part of it's just the overall load. With physical therapy and without the athletic trainers, they can do a lot to work on the muscles, to work on flexibility. You treat the areas around the knee, trying to get those to settle down. Sometimes we do some of these injections, whether it's some of the viscose supplementation, which is like a gel-like substance that lubricates the knee. Sometimes some of our biologic, regenerative, stem cells, PRP, A2M that we do a lot of. These are all things you can do, but again, all understanding that these are never going to fully fix that knee. These cartilage injuries, they're never going to go away completely. You can maybe make the knee happier, less inflamed, less irritated, and as a result, it functions better. But it's an injury that you're going to carry.
Yeah, So there is no time off. He'll heal from this and revert to form. It's a thing. You tell me if I'm wrong. Where this is just you're going to end up, for as long as he plays, he's just going to end up managing the pain and the effects of this injury.
Yeah, unfortunately, that's where these go. And some guys still play for a long time, so, I wouldn't go as far as say this is going to end his career. Obviously, that's what we all fear, and obviously in the scenario where he's not back on the field right now and they're worried about if he's going to make it back, those are concerns that are real concerns. But some of these guys end up playing for a while. They can do things to prolong it if you're really good with managing your time and taking care of your body and doing all these different treatments. They can help, but sometimes you kind of hit that threshold where it's just too much.
What would you, Dr. Stephen Etheredge from BREC is with us here, talking about Ryan Ramczyk's knee issue. What would, if Ryan Ramczyk were your patient, or maybe a better way to say it is, if you've had a patient, when you've had a patient that's dealt with something similar, what would you tell them, and what is a realistic expectation?
Well, you tell them that you're gonna do everything that you can. I've been fortunate to work with the Saints in the past, and we still do stuff with them and with LSU. And in both scenarios, we have a great team. So I think you start with saying, look, we've got a great team around you. We've got a lot of doctors who all have different skills and different things they can add. You listen to your athletic trainers. You have a conversation with the coaching staff in these scenarios. These are players that you talk to coaches and like, hey, his load has got to be less week to week. You work with the player on that. You make sure they understand it, because you don't want them going out and doing extra work that's putting them at jeopardy. But then you also have to be honest and say, look, these are things that, we have to manage. These are problems we can't always completely fix. This is something that will probably give you issues later in life, too. These are individuals that will probably have, other surgeries like joint replacements and things like that in their future. And you tell them, look, you're going to do everything you can. We're going to do everything we can. We're going to work with you on this. And I think you get a good trust with your patients. And I think understanding that sometimes, you can only do so much, but we're going to, one of the things I tell my patients a lot is you have different problems like these that are very stubborn problems. These are problems that aren't necessarily going to go away, and all we can do is be equally stubborn to try and address it. We're going to give everything we can to make you, healthy, to get you on the field, but while still taking care of you. We don't want to jeopardize your long-term health. And sometimes those are discussions you have as well. Sometimes it's not just about what the athlete can do; it's about what they want to do. Sometimes, if you tell the guy, look, the more you do, the sooner you're going to maybe need that knee replacement. There are going to be some guys that say, I'm good with where I'm at. I'm ready, and that's a consideration we have to always have as well.
Yeah. 7 seasons into a career that started as one of the best right tackles in football, and Ryan Ramczyk, unfortunately, looks like he's got an uphill climb for however long the remainder of his career lasts. Dr. Stephen Etheredge over at the Baton Rouge Orthopedic Clinic. Great insight, Doc. Thanks for the time. We appreciate it.
All right, my pleasure.
Hey, thanks so much for watching. Please leave your comments. I love to interact, and be sure to hit the red subscribe button below.